Hi friends, this is Dr. Chinmay Surve. I am PhD Immunology and currently a scientist in Immuno-Oncology in Albert Einstein Institute in New York. Today I'll be talking about coronavirus. What is coronavirus and why is it spreading so far and why it has caused such an emergency like situation in the world? So coronavirus is actually a family of viruses which causes illness in animals and humans. Coronavirus is called corona because, as you can see, this circular viral particle, the red color is a viral protein on the surface of the virus. This red color protein represents a crown like structure. That's why it's called corona. Corona comes from the crown depicted here. So, coronavirus is called corona because it has a crown like structure on its surface. Today I'll be talking about the coronavirus COVID-19. Human several coronavirus are known to cause respiratory infection ranging from common cold to more severe diseases such as Middle East respiratory syndrome MERS and a very commonly known SARS which recently occurred again happening and originating through China. The coronavirus which is currently infecting people in the world is COVID-19. It's a type of coronavirus which has infected more than 80,000 people and has caused more than 2,700 deaths, of which it's majorly localized in China, where 97% of cases have. As you may have seen in the news, it has spread to quite a few countries. It has spread to Italy, China, Iran, Korea, Japan, US, Canada, India, Nepal, UK, Spain, among others include Thailand, Indonesia, other countries in Europe as well. There are other countries which haven't reported any coronavirus cases, which includes North Korea, Pakistan, but may have hidden infection and for various reasons, including political relationship with China, which has prevented them from releasing this information. So, how does coronavirus spread? This is really important because coronavirus spreads from person to person. It spreads through liquid droplets from cough or sneeze from a person. This is the only known pathway of how coronavirus spreads. It also spreads when you touch a surface which has been exposed to these liquid droplets from the cough or sneeze of infected persons. And when you touch the surface and then touch your eyes, nose, or mouth, any exposed surface, this leads to the spread of the virus from an infected person to a non infected person. How do we know if someone has coronavirus? Most common symptoms include fever, tiredness, and dry cough. Other includes aches, pains, nasal congestion, runny nose, sore throat, diarrhea, breathing difficulty, and in some cases sweating. However, the problem with COVID-19 coronavirus is some people are non-symptomatic, in which they do not show any of the symptoms I mentioned above. And this is the major reason why it has spread to so many countries in the world, because if a person is infected and do not show symptoms, either identifying them and isolating them becomes difficult, and these non-symptomatic carriers lead to spread of the disease. So if a person is non-symptomatic, are there any diagnostic tests to find out if the person has coronavirus? And the answer is yes. There are, based on blood and respiratory tract liquids. These samples are collected and the amount of viral DNA is analyzed in these samples. If a person shows positive viral DNA for the virus, these asymptomatic persons are carriers of the virus. So how do we avoid infecting us and others and prevent its spread? So first thing is, if you see a sick person, stay at least 3 feet away from the person. It is said that a person needs to be exposed for about 10 minutes to actually get infected. It's always recommended to stay as far away as possible from a sick person who is coughing and sneezing. Secondly, you should avoid touching your eyes, nose, and mouth, especially when you touch surfaces which are not clean or which may be exposed to infected person. Thirdly, we should regularly and thoroughly wash our hands with soap and water. And lastly, we should start wearing a mask to prevent cough and sneeze droplet inhalation, as the only form of infection has been known to be through droplets of infected person through through his or her cough and sneeze. What you should do if you have signs of infection: firstly, you should cover your mouth and nose when coughing and sneezing, either using a mask, or if you do not have a mask, using your hands to or your napkins to cover your mouth and nose. And if you have fever, cough, or breathing difficulty, please call a doctor immediately. The most important part of this talk is discussion about the deadliness of coronavirus. First and foremost, I wanted to tell you guys that about 80% of the patients who get infected do not need any special treatment, because even though this virus is highly infective, it is not deadly. About only 1 in 6 people who get infected get seriously ill, and among these people, mostly people who are either older, have medical conditions like high blood pressure, heart problems, diabetes, are more likely to develop serious illness. And only fatality is seen among older people or people with inherent medical conditions. The fatality is majorly through pneumonia. So when a person becomes infected, or her airway tract gets infected, which leads to immune reaction and an infiltration of immune cells in his lungs and respiratory tract. This leads to formation of pus and liquid formation in the lungs. This liquid and pus formation in the lungs prevents the lungs from breathing normally, leading to breathlessness, lack of oxygen, and then eventually death. So are there any treatments for coronavirus? Yes, treatments are being worked on majorly in the vaccine field, where patient safety and efficacy is being monitored. It's under government approved clinical trials currently. I also wanted to mention that no antibiotics do not work against viruses. They are majorly for bacteria. So anyone who is prescribed antibiotics, you should not trust them. So in conclusion, coronavirus is highly infectious. It's important to avoid getting infected by following the methods as I mentioned above, and avoid traveling to countries which have a history of coronavirus COVID-19 infection. If you do get infected, you should try to avoid friends and families and call a doctor immediately. Also use face masks and any personal protective equipment to prevent its spread. The coronavirus is not deadly, as only 2% people die, and the major deaths are in elderly or people who have inherent medical conditions. So all in all, COVID-19 coronavirus must not be feared, but we should be cautious about its spread and do our best to prevent it from infecting us and others. With that, I would like to thank you for watching this video. If you have any questions, please write it in the comment section, and please do like, share, and subscribe. Thank you.